Imagine being born in an era where childbirth was a dangerous and a frightening event of life, shaped by limited medical knowledge. Post-delivery infection, that is puerperal sepsis, which may not be one of the most important cause of maternal mortality today, was very common back then.
An infection which can be prevented by a simple hand washing was not even a theory back then. This is the eras of 1800s, when germ theory of disease was not even established. The history of hand washing had its root in this hospital located in this beautiful city of Vienna, Austria. We had the chance to visit Vienna General Hospital to feel the mixed emotion we felt while writing our review article.
This beautiful statue is placed in Vienna General Hospital, and its importance in the history is that his contribution towards hand washing was remarkable, and it has been practiced as an important aspect of infection prevention control practice today, popularly in various sectors of medicine.
Now let us dive into the history and see how this doctor saved lives of countless mothers but remained unrecognized in the medical history.
The history of hand washing starts from Vienna General Hospital, where Dr. Semmelweis was appointed as assistant obstetrician. There were two divisions of maternity clinic. In the first division, only medical students who also attended post-mortem autopsy handled the cases, while in the second division, only midwives. Since inception, first division had increased mortality rates.
The story gets intense here. When Professor Jacob, a friend of Ignaz Semmelweis, a forensic pathologist, died due to a cut that he sustained during an autopsy. Professor Jacob's autopsy findings were very identical to those of the mothers who died of sepsis. This resemblance caught the eyes of Dr. Semmelweis.
Until this time, scientists used to believe in miasma theory, which states that the infection is spread by bad or foul air. But then Semmelweis disregarded this theory and emphasized on transmission of infection by cadaveric or dead decaying body particles. Dr. Semmelweis presumed that the cadaveric particles were transmitted by hands, and thus he introduced hand washing practices with chlorine solution. This intervention dramatically reduced mortality in first clinic, and hence he proved his assumptions with evidence.
But his happiness was short-lived. Nobody believed in his theory. No doctors endorsed in his theory because this would indirectly blame them for all those preventable maternal deaths. The story doesn't end here. Semmelweis' contract was not renewed in Vienna General Hospital, which made him to return to Hungarian hospital for an unpaid position.
Semmelweis did not stop his quest and ended up publishing his scientific findings in this book, which was highly disapproved by medical community. Even after facing so many rejections, Semmelweis was persistent with his findings and ideas.
Semmelweis could not prove his hypothesis, even with strong evidence, and kept on persuading his ideas. His near and dear ones termed him mentally ill and admitted him to an asylum, where he later died of sepsis at an early age of 40.
It is so ironic that the man who paved the way towards asepsis died of sepsis.
So this story shows us that it is basic human behavioral tendency to have a pre-existing belief and reject fresh ideas. But Dr. Ignaz Semmelweis taught us to have a critical thinking and challenge the old norms, and hence this was called as Semmelweis reflex.